Well, there's no doubt we're in a sixth wave. I think all you have to really do is look at the wastewater surveillance graph. And there was an enormous spike in late December, early January, and then it dropped all the way down. And now it's tilting way, way back up again. We will only know in hindsight, truly, when a wave begins and when a wave ends. But it's pretty hard to imagine it's anything but. What we don't know is how big that will be. A wave doesn't have to be huge to be a wave, it just has to be distinctive. And this is definitely distinctive. It's driven by two things. It's driven by a release or an elimination of protections that kept COVID at bay, simultaneous with the arrival of the BA2 Omicron subvariant. So we've opened the doors to a new variant and then eliminated all of our defenses, which is exactly what you would want to do if your goal was to have as big a wave as possible. So that's what we've done. It's going to be worse. There's no question. And let's be clear. There's really no one on the scientific side who said it's a good idea right when a new contagious variant is arriving, when we're still in cold and flu season. No one on the scientific side has said it was a good idea to drop masks, for example. At some point, yes, after cold and flu season is done, after Omicron is done, when the weather warms up and we can go outside, there would be a good time to do that. But we chose a time that was actually really, really inappropriate. And the politicians who did that, I think, did that with a healthy dose of denial. And that denial is going to crumble as cases rise. So yes, I think the politicians are in for an unfortunate surprise. On the science side, no, we're not surprised. It's really not okay to get COVID. It really isn't mild. And certain politicians continue to compare it to the flu. That is really, really wrong. What feels like a really mild case can be doing massive internal damage to your body. It's not that you're young and healthy and therefore COVID isn't going to hurt you. You're young and healthy and it'll feel like a mild cold for some and at the same time be doing massive damage. So you don't want to get COVID. Given if you accept that, the next thing is to understand that in order to not get COVID, you need to be extremely careful and also fortunate. You can't negotiate with the virus. You can't say, I was really good today and was on my own, so I'm going to go to a restaurant and I'm sure it will be fine. That logic doesn't work at all. It's really more like the hockey goalie trying to stop the puck from going in. You've got to have your eye on that puck the entire time. You can't let up your guard. And you can't say, well, my last save was great, so I'm sure it won't go in this time. That's not how hockey works, and that's not how COVID works.